Testing, testing. Yeah. Okay, welcome back, everyone. Thank you for coming back after the coffee break. I will do some brief introductions. We have a special panel. The first panel were really the commissioners and the next generation talking about their experience with the commission. And now we wanted to bring in some people from outside of the commission, many of whom these recommendations relate to, and to hear their thoughts. So I'm going to introduce them, and they're all in the order of how I'm going to introduce, and then we'll start with Husna. So to my left is Husna Sharif. Husna is an Afghan researcher at the University of Geneva's Faculty of Psychology and Educational Sciences, and a scholar at risk whose work and experience focuses on education. And then we have Mumini Kinda. And Dr. Kinda is a Burkinabe physician and a humanitarian leader who served as Chief Executive Officer of ALIMA. Many of you may know ALIMA, the Alliance of International Medical Action, since 2020. And then after Mumini is Leiling Lee Rodriguez, is the Deputy General Director for External Affairs at MSF, at the Operational Center here in Geneva, where she leads external relations and global representation. Following, we have Erica, am I right, Placella? Yes? Placella, see, I knew it was wrong. Eric Placella, who's head of health and food at the Swiss Agency for Development and Cooperation within the Federal Department of Foreign Affairs here in Switzerland. And then finally, we have, Gemma Connell. Gemma is an Australian humanitarian leader at OCHA, where she's currently officer in charge of the Humanitarian Sector Division, and she's also the Chief of Strategic Prioritization Practices Branch. So, welcome, everyone. Thank you for coming at such an incredibly busy time. Apparently, there are some outbreaks going on. So, opening question for you, Husna. Your own experience bridges scholarship, displacement, gender, and education in crisis. What does the Commission's call to amplify voices of people affected by conflict and displacement mean when those voices are women academics and researchers forced out of their own countries?
First of all, thank you so much for such a thoughtful question. Based on my experience as associate professor at Kabul University of Afghanistan, as a program officer at UNICEF Afghanistan, and currently researcher at University of Geneva, when we are talking about the displaced people, when we are talking about the crisis-affected people, especially when they are the category of researchers or academics, so I think we should go beyond the vices. Because I think they are not just vices. They are the group of the people with experience, with the skills, and with knowledge. So in my point of view, it is very important to not just hear their voices. We try to make them contribute into our programs. Because usually when their reports or research, they always focusing on community, that community is something very important. We need community into our humanitarian programs. Without community cooperation, we are not able to deliver our program very well. They are directly affecting our planning procedure, our implementation or evaluation of the program. So overall, we're just focusing on community too much. Here, I just want to say that we have community with knowledge, with the skills, and with experience with us. The one who know this system very well, who is from that crisis community, at the same time working with us here. So they can be, I think, working as a bridge for us. So I think they're kind of assets. We need to use them. So overall, what I'm focusing on is that these are the resources for us, and we need to use these resources. Although they also came from a very different environment, from a crisis department, they need more support, especially professional support. But at the end of the day, by supporting them, we will be able to involve them into our programs, especially for the humanitarian programs. And I think through using of these sources, it will be able to decrease our challenges into our humanitarian programs. Thank you.
To follow up, Ausan, who was the next gen at the end there, mentioned something that we did find is that in academia, many of the same issues in humanitarian assistance occur. So it's often the elite universities that have huge finance and proposal writing that can actually get the grants, where a lot of the national academic or just local academics where we're studying don't have the same resources to be able to respond. Given that you were researcher in Afghanistan and also now a researcher here, what have you seen or what have you observed in terms of when you were there and when you're here and the differences in terms of access and opportunities? And to all of you, that wasn't a question that she's prepared for. I'm just mixing it up a bit.
I think the overall
The different, like for example, the differences in Afghanistan as you were a researcher there, and a researcher as now an international researcher.
I would like to say it's quite a different experience, kind of mixed experience, I can say, because working as a researcher in Afghanistan, which was my country, I love to work there. It was quite interesting for me. At the same time, there were many, many challenges for us, especially for women in Afghanistan. When we were starting our career, from the procedure of recruitment up to the promotion, up to the end of the day, we were always facing issues. We were facing challenges either while applying the research, because there was some cultural barriers regarding the network, regarding the connectivity with the people. So there was different type of challenge, but still we were trying to do something at least. And I think it was quite useful, but we had habit to continue like that in such a difficulties. We try to adjust in that community, but versus working as a researcher in the international university, it's quite different, at the same time very interesting and full of opportunities for me. So since I started here, I never feel myself as someone as a vulnerable group. I based on my experience here, so the network that I have, the people that I'm surrounded with, they're always supporting me. They're really supportive in order to my professional growth, for my career, for my networking. So I think it's quite good experience. But at the end of the day, I would like to share just something very important, that not only for women, for all displaced scholars, I'm telling, they really need more professional support, because when they're leaving their countries, they are not just leaving a threat. They're leaving their professional life, they're leaving their career, their network. So whatever, they're just stopping and coming. So here, sometimes we can see that dealing with them as a local person, which is, I think, not very realistic. They need to work for search for opportunities, same like local person, which is quite difficult for them, because 20 to 30 years of experience they just left behind, and today they need to start from zero again. So I think it is something very important that we need to think about. Thank you.
Thank you. Thank you. Very interesting. We could maybe come back and explore that a bit later, because that's a challenge. So Mumuni, pardon, I keep on saying it incorrectly, Mumuni. Alima is often cited as a practical model of localization, and I have a huge respect for your organization. What does localization mean in operational terms, and how does Alima model, and maybe you can describe that, because I almost asked you when we spoke, is it a regional NGO, is it an international NGO? But what is the Alima model like in terms of redistributing power, resources, and responsibility? And how would it be, is it different from an international, let's say a classic international NGO?
Thank you very much, Paul. I'm very happy to be part of this event. And to answer to your question, I need to talk a little bit about Alima's story, but I won't take a long time. So to tell that, when Alima was founded in 2009, the goal was to establish an organization that would address humanitarian needs in a unique way by locating its headquarters close to the areas where projects are implemented So we decided to have our operational headquarters in Dakar, in Senegal. And this is why people often think that we are regional or local organization. And by more fully involving humanitarian staff from the intervention areas in the response, from needs assessment, project design to implementation and evaluation of the project. And from the very beginning of the creation of Alima, we decided to collaborate with local NGOs with the aim to co-developing projects, but also of helping them build their own capacities. And this means that we manage all resources allocated to projects with local NGOs with the same rigor of management and project quality as if we are operating by ourselves. So in terms of leadership, we have alongside our head of mission, our representative in the field, a representative from local NGOs with whom he shares his authority. And this is very important for Alima. And I can also add that Alima has representatives from local NGOs in his board of directors. And this is very important to make sure that the decisions taken by Alima will take into account what the local organizations want to design and to have in terms of humanitarian response and capacity.
So, I mean, one of the big issues that comes up in localization relates to the indirect costs. You, as a big NGO or an NGO, you get a certain amount of funding, and some of that money goes for the headquarters, other things. One of the problems has been, I think, when international NGOs work with local NGOs, they don't necessarily pass on either those costs, and they don't necessarily, there's often lip service towards sustainability of training, but it doesn't happen. What do you do in that situation? And do you have a rule where if you're getting X percent of indirect costs, you give that same percentage to the local NGOs that you're working with?
Yeah, I can say that this is a big issue of our model, as donors don't take into account these situations. In many times, they often give to Alima 7% of indirect cost, and this is not sufficient to share these indirect costs with our local NGOs. But in our model, it's important to note that local NGOs use the resources of Alima in terms of training, in terms of security, in terms of logistics. We share all our resources with our local NGOs in the field.
Okay, I'm going to come to Erica. So Erica, from a donor and a policy perspective, how do you think global health and humanitarian financing adapt to the current ODA crisis, the growing transactionalism that we're seeing, and also the erosion of the rules-based international order? Particularly curious from a Swiss perspective.
Well, thank you, and thank you very much for the invitation. I've been on the other side. I've not always been a donor, so I understand your, frustration and, in the current context, it's not easy to make priorities. It's not easy to convince donors. But as most of you have highlighted this morning, it is clear that something has to change in the way we allocate budgets, in the way we develop our narratives, in the way we sustain with evidence our narratives, in the way we collect data, and etc. So something has to change in the way we finance not only the organizations, but as we are we are a governmental agencies. We also have to think about how we support health systems in LMICs, how we use country systems, how we use local, not only NGOs, but local entities. So this has to change. And well, and we feel that there is an urgent need. I mean, instead of thinking about what we can do, I mean, what we could add, we think about we think there is a need to rationalize what already exists, actually, because we feel that a lot of mandates, including here in Geneva, among the organizations we are supporting, we feel that, we often talk about mandates, organizations, and we think instead we should talk about functions, public health functions. And then we try to locate them into existing institutions. But most of the time we are talking about, institutional survival instead of talking about public health functions which have to be sustained. So that's the first thing. So we have to be very clear about in the current, ongoing ODA crisis, transactional dynamics, as you mentioned, policies, investments decision, erosion of rule base, etc., the attack on norms and the attack on science. We have to be very clear about the fact that we need to have less. We have to really think about functions and not about institutions. And that's why, for doing this, there is a need to be guided by a very robust theory of change. I will explain what I mean. We feel, as I said, the current narratives remain very blurred. There is a persistent confusion, including in my own organization, between root causes, phenomena, consequences, enabling factors. Most of the time, I mean, climate change is a phenomenon, it's not a theme, It doesn't have to be in competition with food systems or with health, If you want to do something, if you want to invest in climate change, you will start with food systems or with energy. So you know what I mean? So there is a need to have conceptual clarity. There is always an ambiguity between themes, enabling factors, and every donors try to, but most of the time, the narrative and the theory of change it's not clear. So there is a need to have the same understanding about root causes, about consequences. No, the private sector, that's a mean, it's not a theme. It's a mean. Gender is a transversal theme. It's not, doesn't have to be, in competition with health or with food. So, so there is because we cannot no longer afford financially and strategically to maintain organizations with similar and overlapping functions. So in my institution, we started by having this very clear theory of change. We do have 7 instruments working on health and on food. So we started by merging health and food. Now we focus at the interface, which is nutrition. And that's a very intellectual, honest way of operating and engaging in prioritization. Because you don't have to choose between health and food. You talked about the determinants of health. There is no need to choose and to pick up those which are the most convenient for donors. Because if you address the root causes, you will be engaged in more than just one theme. So you can easily sell it that by investing in food systems, the consequence is good health and it's employment and et cetera, at the normative level, but also at the country level.
Maybe a follow-up then. How, when you're dealing with other donors, particularly in this period that we're in, what is your impression in terms, are others thinking like this? Is this, the Commission has a recommendation to develop some sort of humanitarian pooled fund that would be outside of the UN, that would be much more of a public-private partnership. Do you think in this current geopolitical situation it's even feasible?
I mean, I don't see a conceptual clarity among donors, common understanding of what we are talking about, phenomenon, themes, consequences. I don't see this. So every single theme is in competition, and everyone is, like navigating in this very blurred, landscape. And so that's the first conversation we should have among donors. I mean, what are we talking about? When we started to, I remember when during the COVID-19 time, someone told me, because we tried to explain that the organizations we already invest in, they are dealing with PPR, pandemic preparedness and response. At that time, it was the Global Fund, the UNAIDS, and someone told me, no, but we should invest in pandemic preparedness and response, not in UNAIDS and the Global Fund. You see what I mean? So this is the kind of issues and the kind of conceptual clarity we need. So there is I see no intention to, and someone has to bring this conceptual clarity, unpack those concepts. That's the first thing. And then I was particularly happy that you brought in the conversation on the social determinants of health in humanitarian settings. This has never been addressed and never been, part of the conversation. I've worked for so many years with Michael Marmot. We know there is evidence. We know that it makes sense in countries and settings where we are working on trying to bring a systemic change, but it also works in humanitarian settings because it helps to defragment. Once you understand that these determinants of health, they intersect and and they combine and they intersect, you understand that you don't have to choose between water and migration. You see what I mean? Including in humanitarian setting. So it's a very powerful tool to defragment. So a very powerful tool for donors to make change, to make priorities which are intellectually honest and which lead to impact. If you understand this, causal links, and if you get to this conceptual clarity and awareness that sometimes investment in one sector, they have consequences on many other sectors. And the next SDGs, they will not be horizontal. We will have to pick up those who are at the top. And that's not health, it's food systems, because the consequence is health. It's energy, food systems. The way it is now, we have to invest in everything,
Interesting. Maybe we can explore that a bit later too. I'll just go in the order, so I'll go to Gemma. From OSHA's perspective, I mean, we are in an interesting time, shall we say. How does the Commission's call to reshape the humanitarian system, what does it mean in practical terms? I think many of us are aware of the humanitarian reset. What does it mean in terms of coordination, prioritization, and also the humanitarian needs assessment at a time when the needs are expanding and resources are dramatically shrinking?
Thanks, Paul, and privileged to be here today. I mean, I think the first thing that I would reflect on is how much has changed in the last couple of years. 2023, the humanitarian system was the most funded it has ever been. And we can debate whether that's a good thing or a bad thing. I'm sure there are different views in the room, but that is a fact nonetheless. When we closed 2025, we had gone back about a decade in terms of the funding available for humanitarian action globally through the system that I work within. And again, I recognize there are many other systems and networks beyond that. So one thing is that we literally have seen a seismic contraction of humanitarian action in the period that the Commission has been doing its work. And the second reality is that we are under attack like never before. And you've discussed that this morning, but we'll be releasing later today a protection of civilians report. And when you look at it, one civilian killed nearly every 14 minutes was the reality in 2025. And one aid worker killed almost every day. Over 300 aid workers killed in 2025 alone. And those are figures that none of us should become numb to. And that means that when you look at those two factors, a funding collapse and a protection collapse, we're trying to reform. And someone said earlier that moments like this are great disruptors. I agree. They're also the most profound challenge that we've ever faced. and reforming within that space is extremely difficult. So how does that resonate with the report? Many of you will know the reset. I just want to touch on a few things. The first is the D that people often refer to last, which is defend. And that's about defending international humanitarian law, and it's about defending humanitarian principles. And I think, Paul, there's an area around principles where we potentially disagree, but I find the report's challenge interesting and important in this moment as we look to the future of humanitarian action. For us, the principles are something that ground us, that we can hold on to every single day in the face of the most geopolitically complex environment I think we've collectively navigated. That's one. Two is on IHL, that we will not stand back or be afraid. When the emergency relief coordinator, Tom Fletcher, went before the Security Council recently on Lebanon, on attacks against aid workers. It's UN member states who are killing us the most, which I think bears repeating, given that we think it's often others. So defend is critical. You speak to that in the report. We speak to that in our day-to-day work. Define. So this is the prioritization piece. It's a piece I work on very directly, hugely controversial for very good reason, because we're talking about human life. And many in the room this morning spoke about the fact that we should never negate the humanity of the people we serve for the numbers that we deal with. But last year, we actually had to go through the excruciating process of deciding, not just us here in Geneva, in fact, least of all us here in Geneva, our colleagues in every country, who do we prioritize? And this is where the principles come back in. The principle of impartiality doesn't just say a response based on needs alone. It says a response where we reach the people in most urgent distress first. And that, it has been our grounding focus in the last year. But that is horrendous, because that means we are literally, and I think you spoke this morning, Paul, about triage. We are triaging. And I don't think any of us should kid ourselves about that. If you look at Somalia today, we've gone from the World Food Programming assisting 2 million people with food to 600,000 people. It's about 1 in 7. That is at a time when there's a district in Somalia at risk of famine. That's the reality that we're working with. And so this defined piece of the reset, people have different views on it. I think this is a topic we should debate, and debate in a heated way, because it's about human life. But ultimately, we've been grounded in impartiality and most urgent cases of distress first. A couple of other pieces. I think the report speaks a lot to the element around devolve, which is in the reset. It's not just in the reset, it's something we've spoken about for well over a decade as a humanitarian community. And it's been some areas better, some areas worse. And I'm sitting on the panel with colleagues who are great examples of this work. And I know that as a system, we have moments where we show promise, and we have moments where we show great resistance. But I try and dig beneath that. If I look at the pooled funds we manage as OCHA, just a couple of examples. Sudan, last year, we got to $25 million going to mutual aid groups, and people can critique whether that's enough. It's certainly not. But that meant that there were 1,000 mutual aid groups, and we're talking here about really localized community-based organizations providing assistance across the country, over, I think, 300 of whom were women-led organizations. And that's the type of work we've been doing. So getting from big funds to micro grants, but that takes time. To the point around donors, it takes risk acceptance. And also the other profound challenge is we've been trying to do that at a moment when the system literally faced collapse. So we often look at what's the proportion going to local actors versus international actors. We were literally at a point where most of the pipelines were going to break. Literally weeks away from nutrition supplies, to what Erica was just speaking to, running out, weeks away from food stopping, weeks away from cash and voucher assistance stopping, because that's a pipeline too. And not all of that's going to be procured by local actors. So difficult debates, extreme challenges. I see in the report a lot of things that challenge us and the way we've been trying to challenge ourselves. Some places push it out, like what should coordination look like? My one reflection back on that is we've been trying to refine, reform, streamline, but also how do we do that in a way that doesn't fundamentally break things right now, because so much is already broken.
Yeah, no, thank you. I mean, where we certainly struggled as a commission was to try to make recommendations that are far-reaching, but at least realistic and operational. And some places we may have succeeded, others not. I wanted to ask you one next thing. It was a bit relate to localization, but maybe it's rather more about how are the decisions made? I mean, I'm looking right now, and I was going over some of the numbers, and it's interesting because the U.S. government is still, I believe, by far the largest donor, despite all of the changes. But they came in, if I understand, with the $2 billion, where you have to spend it very quickly in 6 months, I believe. How did you work on the decisions of how to get those fundings out? What was let's say the method? I understand ultimately, I think it was the humanitarian coordinator who may or may not have decided, but how did that work?
Absolutely. And again, it's the same humanitarian coordinator who 9 months ago was having to take decisions about how we reprioritize and hyper-prioritize. And I was speaking with colleagues the other day, we're at the end of the line in prioritization because you speak about do no harm, by the way, any further, and we are actively doing harm. So those HCs with advisory boards, and I want to stress this, we're looking at what were the most urgent things that needed to happen and really focused on the life-saving, because here we're talking about responses that were on the brink of collapse, responses where people were about to have their assistance cut, responses where people's lifeline was literally about to be severed. So they focused very much on that. And again, I know there are different views around that, but if we're to look at the child who's about to not receive the assistance that stops them from dying, I think that comes into focus. So life-saving as a top priority. And the second thing they were looking at is, in their context, what is required right now? And that looked very different. So 2 contrasting examples. Sudan, pipelines were about to break across the board. And the HC took a decision, we're going to focus on getting the pipelines in, and we're going to go big on cash. Because cash is one of the ways that we can reach more people with more dignity, by the way, more easily, more rapidly right now when the system's on the brink of collapse. And then you contrast that with Ukraine, where because of where they were at in their response, a lot of the funding still managed to get to local actors. There's 3 incredible local and national NGO consortia who are doing most of the frontline response in Ukraine, and the funding went there. So every HC had to sit back with the advisory board very quickly, because we didn't have the luxury of time. And I want to be really clear about this. People could say you could have been more consultative, you could have been more inclusive. Absolutely. Absolutely. Was it perfect? Categorically not. But did we have the imperative of time? Yes. Yes. So within a short space of time, trying to get the decisions right. And every HC, humanitarian coordinator, that I have sat with, been in meetings with, listened to, has said, and hold me accountable. Hold me accountable as to whether we got those decisions right or not. And then we look to the future. And we look to how we complement that with more work on other areas that take more time, that take more deliberation, that require more work. And we will continue to do that.
One last follow-up, because you said something in your first time about it's really difficult right now to think about strategizing for the future while you're cutting posts and you're just trying to survive. But a lot of us have said that this is a time, potentially, to actually a time for change. What do you think about that? Is it really possible when you're sort of everyone is quite reactionary at this point because everything is changing all the time? Is it possible to do both of those things, do you believe?
Whether it's possible, I think, is an impossible answer, but whether we have to try, absolutely. But let's do that realistically, right? If you look at UN Women did a study in, I think, March last year, where they spoke to over 400 women-led organizations. And at the time they did the study, over nearly half of them expected to close in the next 6 months. Most of the local and national partners that we work with are the ones who face the immediate brunt of all of this. Thousands of staff cut, organizations literally closed, or then having to rely upon volunteers where they used to be able to pay salaries. So we absolutely have to keep the pressure on ourselves to do better, to do differently, to reform, absolutely. But we have to do that knowing the context within which we're trying to do this. And that context is tens of thousands. I worked on a study at the beginning of last year on the immediate impact of the cuts, and bear in mind, this didn't start with the United States of America. The Europeans dropped out of the system before in bigger fashion, but it was masked in 2024 by continued huge funding by the United States of America. But when we did it, it was tens of thousands of aid workers laid off, thousands of offices and sub-offices closed, and most of those most immediately affected being local and national organizations because their cash reserves were smaller and because of the financing structures. So do we have to keep going? Yes. Is it possible? We will have to see, but we need to hold ourselves to account that we tried as much and as hard as we possibly could in the circumstances that we're in.
Thank you. So to Lei Ling, you and I spoke yesterday, and I was on a train. I want to make sure I get it right. But in terms of humanity and impartiality, we spoke about that. You, if I understood correctly, on a bad line, you said at times, am I correct, that it may not really even be possible to be able to implement or to follow all of that given the current circumstances that we're in? Because I was thinking a little bit more about neutrality and independence. Did I understand that correct? And can you expound upon that?
Well, first of all, I want to commend the Commission for the excellent work and really very ambitious recommendations that you've put together. It's really commendable work, and thank you, because I think all of us in the humanitarian sector will benefit, I hope, from those recommendations, and we'll get into that, I think, in the future. What I wanted to say is that one of the observations is that in the report you refer often to the term non-negotiable, and when it comes to, and I'll speak about independence, because for sure, as MSF, we uphold this principle as much as possible. But what I wanted to say is that, for example, while you say it's absolutely non-negotiable, the reality of what we have to endure and experience is often challenged us in this principle. So to begin with, since its inception in 1971, so it's been 55 years of MSF doing this work, the choice was made to only accept funding from independent sources. So today, we receive only 1% of our close to 3 billion global funds from donor governments. And we actually benefit and very fortunate from over 7 million individual donors around the world. So this has allowed us to maintain this independence of action, meaning we are able to go in and assess needs based on the assessments that we carry out. But then what does this mean? I think we already talked about whose needs, who defines them, who are we talking to when we do these, what we call explos at MSF. And basically, and this is a conundrum as well, because what we need is to have the access to the people that are affected by health needs. We need to have trust with the people that we're engaging with. And to have trust, we have to also have the perception from them that we are not engaged in favoring one side of the conflict place or another. So these are all, and so what I'm saying is that in terms of the principle of independence, this is challenged, I think, when we come to these situations when we're trying to provide assistance on the basis of what we observe, but where it will be challenged, and predominantly today by governments or authorities, I should say, that have other interests in mind. And I can give the example in Iran, where we were providing care for populations who were Afghan refugees. And there the care was very much negotiated. So this is where we negotiated this space because the local authority said, okay, you can do this, but no more. And then the attacks came. The attacks came, and many people were displaced, as you all know. And it was only then that somehow we were able to negotiate and said, well, okay, the needs are really huge now. Can you please, provide care to those IDPs in Tehran? So we were previously on the border areas, and then we went to it. So what does that mean to our independence? We compromised. I think, as self-reflections, we compromised. We had very difficult conversations with our Iranian colleagues who were saying, MSF must speak out about what's going on. We must provide witness. We must say that what's going on here is unacceptable. And those were really hard choices, because then you see we're balancing between speaking out and witnessing versus having access to a group of people that really needed our care. So that's a little bit what I was trying to convey to you in a 5-minute telephone conversation. But if I may, I think another important conversation here is the shift of power. And I don't think we've spoken about when political leaders are making decisions that really impact the health and the livelihoods, the future of the people we're trying to assist. We don't talk frequently that in these wars, we're talking about, I'm thinking about Sudan and how we as MSF are having to negotiate access in both Darfur with RSF, with Sudanese armed forces. And yet we're not talking about the fact that we don't have access to the political actors that are in fact proxies to this war. We cannot negotiate. It is not role to negotiate with them. And so we have a very local, geographically local focus on this, but the fact is that shifting the power, I know you're talking about shifting power to local communities. I think we have to talk about that the global geopolitical dynamics in which we work, which is shifting the power. How do you do that? How do we as MSF, as humanitarian actors, possibly, how do we influence that? It's not easy. So that's why I'm saying we negotiate every day. My colleagues negotiate on a daily basis, and the consequences of that is huge moral distress. I think every day they're having to make choices, like you do, who lives, who doesn't, but then they have to go home. They're also impacted by the war around them. And this, for us, I think, increasingly at MSF, we're dealing with this duty of care and what we call solidarity, meaning how do we provide this care for the mental distress, psychological distress, but also for the livelihood needs that they may need, and how can we support that as well? So for us, solidarity is also solidarity with our own colleagues who are deeply affected by war.
No, thank you. So the report or the commission says the non-negotiable is the humanity and impartiality. And then independence, in fact, we're saying that they are subsidiary independence, neutrality, and it depends on an organization. So ICRC, for example, of course, would never not continue with independence and neutrality, but some of the local NGOs may. So that was at least the subtle, what we were trying to what was non-negotiable and what was. Maybe 2 quick questions. I'll put them together so to save a bit of time. One is, I think most are envious of MSF that they have not had the same financial constraints as most other NGOs. But speaking with you, speaking with Christos, it's very clear that despite that, you have still been affected operationally on the ground. And so I'd like to hear about that.
Yeah, absolutely. Absolutely affected. Again, from the perspective of, we don't work in a vacuum. MSF absolutely does not work in a vacuum. And in many of the places where we find ourselves, there's been, I would say, let me start with the easier challenge, and that is the logistical access. So often in the Sahel, in Niger, we depend on UN humanitarian aviation services. And during this Actually, what I like to refer to is like the humanitarian system earthquake, seismic shift, which I think we're still feeling the shock waves from that earthquake. And one of those was that those flights were cut. And so we were faced with the decision of, okay, we can't go to our project locations anymore, or we have to find other means to be able to fly the supply and so on. And so luckily, we were able to then finance our own private aviation, but normally we wouldn't do this kind of thing. So that's kind of more logistical in nature. The other thing that's happened is that in Sudan, we were able to, in Khartoum, able to actually there's a particular local association, the Sudanese Family Planning Association, that would have gone under, was not able to support what the family and child sexual reproductive health services that we provided. And so we decided to support them directly and to say, we want you to keep working and we would like to continue to collaborate with you. And so we've had many requests like this one in various countries where we see that the people that we collaborate with at community level or even regional level are facing complete disappearance and dismantling, and we've come to support them so that we can continue working together. And that even applies to the ministries of health, I should say. I don't know if many people in the room know, but I mean, our collaborations with the ministries of health is very, very close. And within our organization, we debate a lot. How close should we be collaborating? Every context is different. But just to say that in the face of so lack of supplies, lack of staff, and lack of funding, MSF will support hospitals and health facilities run by ministries of health, because we do believe that ultimately it is the local health system that has to be sustainable over the long term. And the idea is not for us to be there forever.
So quick follow-up is also, so suddenly you were in operations where other NGOs had to stop what they were doing or dramatically reduce. Did you then have to reprioritize what you were doing to take over certain areas, or did you continue on? And then, so what was the effects of that on MSF?
Particularly, I think, particularly with our nutritional programs, there was a sudden stop by WFP on supplies, and we've had to make several very unplanned, unexpected purchases of therapeutic food, and also we've had to make very unplanned purchases of the short term, I'm not a medical person, rape kits. So yeah, post prophylaxis, this kind of thing. So because where we were getting provision for these kinds of supplies were no longer available from the organizations who are providing. So WFP, and in the other case, it was more of a local organization in DRC, in fact.
Okay. Great. Because of timing, what I'd like to do is give the audience time to ask questions. And so we have around 15 minutes. So let's open it up for questions or comments to the panelists. Yes, please. Right over there. We'll take 3 and then we will answer.
Good afternoon, everyone. Thank you so much for all the remarks and the panelists for sharing your perspectives. My name is Israt Shakir. I'm the founder and CEO of Every Pregnancy. It's the first Muslim collaborative for maternal newborn health in the world. And we have over 65 organizations that are championing maternal health in the front lines in over 21 countries. I wrote my question down so I could be succinct, but as faith-based providers are often the last ones providing care, but are not mentioned in the Commission's report or in your conversation. How do you see the role of faith-based providers in philanthropy in addressing the failures you describe in the current humanitarian financing architecture. And why I say this is because via our coalition, we were able to mobilize over $91 million in the month of Ramadan this year alone. That has 100% gone to programming, and in places like Gaza, which I've also noticed has been absent from the conversation, despite the genocide being extremely impactful on the work that many of your organizations do, especially MSF. So I would love to hear your comments and reflections on this. Thank you.
Thank you. Let's get another question or comment. We see over a gentleman over there. Oh, there.
Thank you. Hi, I just wanted to put it.
Introduce yourself, please.
Hi, I'm Daniel Martinez Garcia. I work with Doctors Without Borders. And I wanted to question if it was a choice to position the report without addressing the political root cause of the current reduction and destruction of the humanitarian space. It seems like we talk about cutting of funding that happened in a vacuum, or restructuration that happens in a vacuum. And that is part of what I feel that might be part of the collective cognitive dissonance of the humanitarian sector. This is not occurring in a vacuum. And the report, I've only seen the executive, right? It doesn't seem to address that. So was that a deliberate choice, or is that it's just too complex to put it because we don't have the capacity as a humanitarian sector, or should we just remain not linking to that? Thank you.
Thank you. And one more, if anyone has questions or comments. Okay, let's start with those two. Does anyone want to address?
Faith-based.
Yeah, let's talk about the faith-based. Just go ahead.
As MSF, we absolutely welcome the role of faith-based organizations. I think the question was more to the commission and why it was absent. No, so I am not able to answer that particular question.
It wasn't absent. It's actually, and I mean, the page, I think it's 70 pages, but faith-based organizations, private sector, other groups that may not have been, I mean, faith-based have always been involved, but we're actually calling on many more than just sort of classic international NGOs involved. So faith-based is actually specifically mentioned there. It may not be in the executive summary. It's massive, but have a look at the report itself. I do have a question related to that. So I'll do that, and then Xavier, I'll get to your. So there is, yeah, it relates, so maybe you can answer as well. There is a push now more and more clearly by the US government for Christian US faith-based organizations. So I'd like to hear what others think about that as well, putting that into the mix.
I mean, maybe I can come in on this. Faith-based organizations have, for the entirety of my humanitarian career, been part of the work that we do and very engaged in it. Now, as with any organization, there's a spectrum, but let me go back to, I used to work in South Sudan, and I worked in the humanitarian country team there, and we had Samaritan's Purse and Islamic Relief on the humanitarian country team. And I think that tells you, I mean, it's a rotating thing between the NGOs, but there are two faith-based organizations that were directly present. So just to say, I think that the bigger discussion is not about is it a faith-based organization or not a faith-based organization. The bigger discussion for us right now is what's the nature of the organization we're engaging with in each context, and are they the principles come back in these discussions for us. How do those organizations, be they, again, regardless of faith or not, are they expressing, upholding the principles that we've agreed to work by in that humanitarian operation? And there are some faith-based organizations who may choose not to, and there are some non-faith-based organizations who may choose not to, or who may be set up specifically not to, Gaza Humanitarian Foundation being a case in point. So it's really, for us, it's about, are you as an actor engaged in this response in a way where you're committed to, my organization is the Office for the Coordination of Humanitarian Affairs. So are you committed to coordinating? Are you committed to the principles? And in most operations, we try and establish what we call joint operating procedures, which lay out basic criteria about which actors are going to be more engaged in the response, potentially receiving funding through the coordinated response, et cetera. And I wanted to appreciate the work you've done during Ramadan. I think that the incredible work that faith-based actors do to galvanize resources, both, again, across the faiths, it's remarkable what is possible. And again, for as long as I've been a humanitarian, that's been an absolutely integral part of the work that and the partnerships that we have. So I just wanted to reassure you of that. And it's fascinating and inspiring to hear what you're doing. On Gaza, you said it hasn't been present. What I would say is it's present in every single statistic that I gave and in every single comment that I made. And that is the case, I think, for humanitarians today. I was myself in Gaza in December 23 and January 2024. I don't think that any of us in the humanitarian community have witnessed anything that is in any way, shape, or form the equivalent of what has unfolded in Gaza. It is horrific. It shocks everybody's conscience who has a conscience. And again, for me, every single thing that I said, Gaza is in it. I may not have said it specifically, but the statistics, Gaza's there. Where have most civilians been killed? Gaza. Where have most aid workers been killed? Gaza. So it's in everything that I said.
Yeah. I would also, I mean, just from years of humanitarian work, faith-based organizations are always, they're always there. So I don't think of them as not there. They're part of the fabric. One aspect that we do talk about in the report, which is problematic, are sanctions by many Western countries where therefore you can't work in certain areas, many of which are maybe have faith-based organizations. And for your where are you there, Yossami? The report does, in fact, one of the reviewers talked a lot about power dynamics. So we actually do mention this in the larger report about what is happening now, and that this is not in a vacuum. We give the whole history of this, and we talk specifically about concerns about transactional nature of what is happening now, about some of the bilateral funding that is occurring as opposed to multilateral. So we try to do this head on. The harder part, though, was a bit what you were suggesting. We wanted to be this practical versus operational. So we didn't say the obvious that the UN Security Council needs, to be reformed, and until something like that happens, impunity is going to be problematic. And similarly, we didn't take on some of the root causes of, let's say, the current political dynamics, because there was a discussion already early on with the advisory committee and some of the commissioners in NextGen, how much of this is health and how much of this is humanitarian reform. And we made it very clear that we felt we couldn't. So that's why this isn't a traditional Lancet commission, I don't think, in terms of focusing solely on health. It's the humanitarian system that must transform, and then health can also then have a much larger effect. So it was I would say a back and forth a little bit on that one. Maybe Erica and then Leiling.
Yes, it's not too, I don't have an answer for your question, but I wanted to bring the issue of norms, and evidence-based policies, because we talked a lot about budget cuts. So I understand localization, NGOs at the country level being, under pressure for institutional survival and viability. But I think what really worries me, as a donor, but as a public health person, is really the fact you mentioned the operational vacuum. I think there is a regulatory framework, normative vacuum at the moment, and a lot is happening outside of WHO. Much more than what is happening within WHO. And with these investments, which you mentioned, they are shaping new norms in health, in nutrition, in food systems, and also because there was a huge collapse of data sets, with the dismantling of units. I'm talking here about raw data, data we use including donors, for drafting our interventions. This disappeared. So we don't have data. To shape norms. And on the top of that, norms are not being shaped within, usual suspects organizations. I'm not only talking here about WHO, I'm talking about the FAO, and we also have a huge collapse of data sets when it comes to migration. It's not only health. So we really have to rebuild and to fill this vacuum in terms of data, evidence-based, policies, and norms. So I know funds are important, but for me, the most important, the main challenges is really to go back to this rule-based order and the respect of international, mechanisms, and tools and instruments we have shaped for so many years, the IHR, there are many more for food, for example. Because if only, traditional donors are still investing in moving forward those instruments, and no one is, respecting that and recognizing and being aware that this is the way it should be the investment should be made, then we will be alone in this normative vacuum. And everything will happen, is already happening now, outside of norms.
Ling?
No, I just wanted to raise the point that while the Commission has you've made very practical recommendations, I think it's going to take a lot of courage to actually implement them. And as you well said this morning, it's the implementation that's really going to show whether this is going to move forward or not. My particular question is, I wonder, whether there's enough incentives. What are the incentives for people who hold power to cede the power? What are the incentives for upholding international humanitarian law when, as you rightly point out, the UN Security Council will continue to veto? So for me, I think the challenge is for all of us to really take up the torch where we can, and do what we can, because we do need to change, MSF included, and we are taking steps to do that. But we can't, again, we don't work alone, and we can't do it alone. So I just wanted to commend you, but also say, let's.
No, we're aware.
It's a little bit of idealism is not bad. It provides hope, and the intergenerational impact is phenomenal. And I really commend you for including the next gen aspect there, because if we're going for longer term impact, we have to engage much more with younger audiences, younger people, and they're so committed. We see in the climate space how they've really mobilized and made some changes, I think, in the public discussion.
So let's end, but for 10 seconds to each of you, I have a question. We want to end at a slightly optimistic note during a very pessimistic time. In the next 12 months, what do you hope your organization will achieve or transform that will be making a difference in the humanitarian sector? And for you, I think it would be more on a personal level in terms of what you see as a scholar from Afghanistan. What sort of hope or change do you have? And we'll come to you last. So let's start with Lei Ling, and we're just going to go across.
I just do like more than 10 seconds.
C'est pas facile, hein?
There are a number of initiatives we're taking within MSF, and I'm just trying to decide which one I will share publicly. We are undergoing a huge reform within our organization, and we are looking at themes of power as well. How do we organize ourselves to be more attentive to local communities and the patients that we serve? In tandem with that, with our own personnel, we're looking at completely rehauling our system in the next couple of years, so that we will not be talking about international or locally hired staff. It'll be one MSF colleague. And so I'm really excited about those changes. And I think that will make a difference in the mindset and mind shifts that we take within MSF.
Goodness. Okay, I think a couple of things. One is to be relentless in the advocacy that we do for the people who we serve and the people who serve them. I watched recently a clip of these incredible paramedics in Lebanon from the Lebanese Red Crescent saying, "Tell the world to protect us." And it broke something, because the fact that we have the bravest people on the planet serving their own communities who are fully protected by international humanitarian law having to say, "Tell the world to protect us," there's something fundamentally broken. So I hope that OCHA plays its role in that space in a very meaningful way. The second is, and this one's going to sound a bit technical, but it links to a topic that was discussed a lot this morning. Many of you discussed community feedback, community engagement, etc. In my own view, there's no shortage of community feedback, community engagement, community sharing views. The challenge is, how do we have that change the way that we work and our system? And I think that's the piece we've not tackled. So the team I work with is working right now on this piece around how people's priorities and how we track a response against people's priorities and preferences and whether it really changes. So I know that sounds detached and a bit anodyne, but honestly, we've got so much feedback and we've got so many views and perspectives. What we haven't managed is a systems shift. So that's a piece that I'm really hopeful that we can deliver around. And the third piece is how we do continue to step up and play that role for the shift of power within the system, which is not easy. It's deeply complex. And again, how we do that without breaking things, I think, is incredibly important.
2 points from my side. I already mentioned them. For the first one is about defragmenting and using intellectually honest narratives to defragment, using principles which are, again, intellectually honest to for budget cuts. Not using buzzwords and just to save organizational entities within my organization. And then it's really about investing in rebuilding data sets, bringing science back, and contribute to norm setting at the global, at the regional and continental level.
Okay, for Alima, I think we need to engage more with more local NGOs. As we are working with 6 local NGOs in 5 countries, I think we can do more, but we don't have enough funding for that. So we need to make an advocacy and to say to donors that we need to collaborate with local NGOs. We don't need to see to make a competition between local and international organizations. What I can say is that we need more engagement of local organizations, but we don't necessarily need less international organizations because we all know that the needs are very huge at the moment. So we need to make advocacy for that. And I think that we need also to say that we have some models that are working. And I think that the model, Alima's model, is a good model. I can let every one of you go into our results and make your own opinion on that. But I think that donors need to provide more funding for these various models. And I'm confident that this will lead to the emergence of reputable local NGOs in humanitarian settings.
Well, thank you. At the end, I would like to say that I think the crisis affected people are alive with hope. So a small change can be very big for them. And As per my experience, I work directly in the field in the most backward province of Afghanistan even. So during the visiting into the field, I have seen many hopes into the children's eyes, I think, which is something very important. And with a small movement, with a small work, or especially for the recommendation that we had in this report, through applying this one, I think at least we can help them to achieve their hopes. We will lead them to not be hopeless. And I think regarding the researchers and scholars replaced scholars, I think each of them can work through this procedure through their own specific areas. For example, I'm professional in higher education in emergencies, and my current research is digitalization in higher education in emergencies, where I'm focusing more on planning, implementing, evaluating of the program in the crisis context in the global south. And at the same time, I'm working on teacher education and teacher trainings on the context localization of the program. So it might be finished after some months. So I think I would like to do something through my field, through the result of this current research that I'm doing. It might be very helpful for the crisis affected countries in the global south. I think the result will be very helpful along with the recommendation that currently I'm trying to gather the data for that one. Overall, I would like to say that every time I'm focusing on this word, that doing something is better than nothing. If we do a small movement, it will be very big for the children who we are their hope. Thank you.
Thank you, everyone. Well, thank you very much for the panel. We're going to step off now, and I believe Carl is going to come. There you are. Great. Thank you.
Thank you very much. Thank you very much to your